a pill so that he could become a billionaire. Let us make no mistake about it. And this is a point that I'll be making over and over again. Not here today, but all over the country. And that what we are involved in is not just health care legislation. We are involved in a great struggle, not unlike, to be honest with you, the struggles of the labor movement, the struggles of the civil rights movement, struggles of the women's movement, struggles of the gay community, struggles of the environmental movement. This is what we are involved. This is not just an idea that Kirsten or Jeff or I and a few others thought of. This is a struggle for the heart and soul of who we are as American people. And this struggle will be opposed, let us be clear about it, by some of the most powerful forces in the United States, entities that have unlimited amounts of money to throw against us. The insurance companies, the drug companies, and everyone who profits off the current system will spend many, many hundreds of millions of dollars to defeat us. They will run endless 30-second television ads telling you all how terrible we are. They'll be putting full-page magazine ads or magazines all over this country, and they'll have misleading studies to frighten the American people about Medicare-for-all, which is exactly, as you may recall, what happened before the passage of Medicare in the 1960s. And the reason that we have a healthcare system which is dysfunctional is fairly obvious. It is not just the huge profits in the insurance industry and the pharmaceutical industry, but it is the incredible waste and bureaucracy developed by many thousands of healthcare plans. Today, hospitals and doctors must deal with patients who have different deductibles, different co-payments, different networks of coverage, and different coverages for pharmaceuticals, or no insurance at all. All of this is not only driving doctors and nurses and hospital administrators to distraction, but it is wasting up to $500 billion a year. All of that bureaucracy, all of that administration is wasting enormous sums of money. In my view, and I think I speak for everybody up here, the American people are increasingly clear. They want a health care system that guarantees health care to all Americans as a right. They want a health care system which will lower health care costs and save them money. They want a health care system which will guarantee them freedom of choice in terms of the doctor or hospital they go to. They want a health care system which will substantially lower the cost of prescription drugs. They want a health care system which will finally give senior citizens the benefits they need for dental care, for hearing aids, and for eyeglasses. Brothers and sisters, in other words, the American people want, and we are going to deliver, a Medicare-for-all single-payer system. Thank you. And now, let me introduce somebody who has been fighting for health care for all from New York State, Kirsten Gillibrand. Kirsten.
Thank you. Thank you, everybody. So let me talk about the problem. No matter where I've been in my state, around this country, the number one issue on every person's mind is access to affordable health care. Number one issue. And with President Trump constantly undermining the work we did in the Affordable Care Act, people are really afraid. They're afraid that they have a pre-existing condition and nobody will cover them. They're afraid that their child has a disease or an illness and they won't be able to get the medicines they need. They're afraid that if they actually have to pay for the medicine that they need to survive, they will go bankrupt doing it. It is unconscionable that people in America don't know if they will survive a disease or a healthcare illness or something that's going to affect their lives or their family lives because of the greed and corruption in Washington that decides everything. But that's the truth. They're afraid. And people are suffering. I can't tell you how much they are suffering. I had to meet a young man last night who's had multiple surgeries, and he doesn't know if he'll survive. He doesn't know if his life will be in front of him because if his access is taken away, he just doesn't know. And this is something that is so vital to humanity. Healthcare must be a right, not a privilege, because it is what we believe. It's what our country needs. This has to become the next social safety net. It has to become something that is there for you no matter what. No matter if you can afford it, no matter where you live, no matter what. So we have to take on the problem. Now, Bernie mentioned the problem. The problem is greed and corruption. The problem is how everything works here in Washington. Do you know why Medicare can't buy in bulk to get the cheapest prices? Well, it was a sweetheart deal made by Congress and the drug companies in the dead of night when we passed Medicare Part D under George W. Bush. That's how laws are written. The special interests, the most powerful, people with endless supplies of money, they get to do whatever they want whenever they want it. So this is a moment when we have to decide what kind of country are we going to be. And this is a decision that every single one of us has to make now. It is something that cannot be put off. It cannot be delayed. We have to say, will we fight for this democracy? Will we take back this democracy? And the way you do it is you get off the couch, you stop throwing things at the TV, and you start marching. You start marching. You start protesting. You start campaigning against members of Congress, senators, and presidents that don't share this human right, this value that we share. You put your whole life and your whole body into the breach, because if you don't, we will not prevail. It is up to us. And so we got to get money out of politics. We got to have publicly funded elections. We got to actually restore voting rights. We got to make sure these legislatures around the country can't take away our right to vote. We need everything to make our democracy ours. Automatic voter registration, getting election day off, making sure people can vote by mail, having those paper receipts, all of it. So this is what we're up against. And the way to get there is really simple. And I'm going to tell you how we're going to pass Medicare for All and how we're actually going to make it a reality. The part of the bill that Senator Sanders and I worked on together, the part I got to write, is the transition phase. And let me be really clear about why this gets us to Medicare for All single payer. If you let Americans decide today that you can buy into Medicare for a small percentage of your income, for the lowest wage worker, it's 2%. For the highest wage worker, it's 5%. And you get to buy in no matter what. You are creating a not-for-profit public option that is good, high-quality health care now. I dare any insurance company to just try to compete. They won't. The insurance industry wants to make money. They are a for-profit industry. Their goals are not aligned with ours. That's why we could never get where we wanted to go with universal coverage, building it on top of a for-profit industry. Because they must maintain corporate profits. They must maintain shareholder value. Bernie just gave us an example of somebody who got a $500 million golden parachute. The money, the greed, the corruption that surrounds our healthcare system today is what is in the way. It is why it is not possible. So let's let competition work its magic. Let's actually have greater competition. Say, anybody can buy in. I promise you, I would on the first day. If I could buy in at 4% of my income, yeah, that would be great. And I'd get all the coverage I need. I would get the medicines I need. I would get everything. And if you fix Medicare in this process, making sure you have more transparency, making sure that providers are reimbursed the right rate for the things they're providing, making sure healthcare becomes a continuum of care. Places like the Mayo Clinic, they know how to do this. You lower costs, you get economies of scale, you get people into preventive care. That's how you bend the cost curve. And if you provide that transition period, I promise you, you're going to get to Medicare for All as a single payer because the American people are going to choose it. I ran on this idea in 2006 in a 2-to-1 Republican district. Do you hear what I'm saying? I ran on this in a 2-to-1 Republican district. Red, red, red. Not only did I win, but I got reelected by a 24-point margin. That is how you get to Medicare for all. If we take this democracy back, if we fight with our voices, with our views, with our hearts and our souls, we will prevail.
Thank you, Kirsten. Jeff Merkley has been a fighter for Medicare for all for many years. Jeff?
Thank you so much. So, how about a little appreciation for those 60-plus organizations, grassroots organizations that are going to fight to make this happen here in the United States of America? So I have some questions for you all. Should healthcare be about profits or people?
People!
Are you angry and frustrated with the system with enormous complexity?
Yes!
Are you frustrated by the enormous price gouging in the medical drug industry?
Yes!
Are you ready for a simple, seamless Medicare for all plan for all of America?
Yes!
Well, I'm so glad to hear it because I can tell you this. As I go out around all of my town halls in Oregon, and I have 36 counties, 22 very red counties to build on what Kirsten was saying, they are frustrated with the complexity in America. You earn a little bit more money, you're kicked off of the Oregon Health Plan, that is Medicaid. And then what do? You have an employer who says, now I'm not going to cover your children. How do you get your children covered? Another employer says, I'm not going to cover your spouse. How do your spouse get covered? You're always in transition. Employer changes health care plans, and now you have to get a different doctor. It's the most complicated system in the world. How about a simple, seamless plan for all Americans? And then we look at the enormous cost of it. We pay twice as much and get less health outcomes for Americans. How about we pay less than other countries and get more outcomes than countries? Let's stand that on its head. Well, I hear people come into my town halls and say, I have a simple inhaler. I pay $100 here. It costs $4 in Europe. Why is that? I have a cholesterol drug. It costs 5 times in America what it costs overseas. Why is that? I have a diabetes drug that costs 10 times as much, even though insulin's been around forever. Why is that? It's the profit in the medical drug system. That's why we need to have a plan where we negotiate the price of drugs so that we get a better deal than the rest of the world. You know, we spend a lot more on research here in America than the Canadians do, the Europeans do, the Japanese do. Shouldn't we get the best deal in the world, not the worst deal in the world? So now we have to make it happen. And we're up against this enormous, enormous amount of money that's going to try to mislead people. They're going to use the gerrymandering and the voter suppression and the dark money. Our Supreme Court's been right at the center of this dysfunction, this corruption of our constitutional we the people vision. You know, I love those first 3 words of our Constitution. I love Jefferson talking about distributed power. He says the only way, he called it equal voice. He said the only way you get laws that reflect the will of the people is to have distributed power, not concentrated. But here's the Supreme Court concentrating power through Citizens United. And then voter suppression. We saw it in every form on November 6th, trying to take away the vote from poor communities and communities, minority communities, and from college communities, taking it away from Native American reservations. How about we believe in voter empowerment, not voter suppression? So one of the pieces we have to do to win this fight, we have to pass the For the People Act that will take on gerrymandering and voter suppression and dark money and restore the vision of our Constitution.
Well said.
So we're going to do it together, enormous outside force, inside force. Thank you for being in the battle. We need every American off the couch and on the battlefield. God bless you all.
Thank you, Jeff. Now we're going to hear from some very special guests who are involved in the struggle, not only politically, but in their work every single day, who understand what a dysfunctional healthcare system means for the patients that they deal with. Let's begin with Renelsa Cordil, who is a registered nurse in the Cardiac Procedures Lab at Washington Hospital Center here in D.C., and she is a member of National Nurses United. Renelsa?
morning. Good morning. My name is Renelsa Caudell. I'm a cardiac registered nurse. I work at the hospital center here in the district, and I'm a proud member of National Nurses United. Becoming a registered nurse was one of the most important decisions in my life because it gave me the privilege of being able to provide a healing hand to my patients that are hurting, are in pain, and that are their most vulnerable. But it's becoming harder every day to provide the care my patients need. I recently had a patient who had been unemployed for 9 months. His health insurance had been tied to his employment. Therefore, he lost his health insurance when he lost his job. As a result, he could not afford to get care and medications he needed for his high blood pressure and diabetes. By the time he got a new job and had health insurance, his heart had begun to fail. As a result, this patient is experiencing new onset heart failure that would have been presented if he had gotten the care he needed. I recently had another patient with a serious heart problem. This patient had suffered an earlier heart attack brought on by severe stress. When she presented at the hospital with concerning symptoms, the doctor recommended that we take a CT scan to assess changes in her heart health. He did not want to do a heart catheterization, a more invasive procedure, unless the CT scan showed that it was necessary. I took the patient down to get her CT scan. In the middle of the procedure, we received a call telling us that we did not have authorization to conduct this procedure because the insurance company would not pay for it. So, in the middle of the CT scan, we had to stop the procedure and take the patient off the table. Insurance companies should not be overruling the decisions of medical professionals. They should not have the authority to prevent patients from getting the care that they need. Thank you, Senator Sanders, for continuing to take a stand that healthcare is a human right, guaranteed for every man, woman, and child. Every day at hospitals and clinics around this country, bedside nurses care for patients who have delayed care because of lack of insurance or because of high deductibles and copays. We need to take insurance companies out of the equation and enact a single-payer Medicare-for-all system. To me and other registered nurses across the country, it is immoral that anyone profits from another person's needs for health care, and it's disgusting to me that profit can come from denying care. The way to stop this is by passing Medicare-for-all single-payer legislation. And I'm here to tell you that nurses across the country are going to fight for it. Yes. Thank you.
Thank you, Renelsa. And now we'll hear from Nicole LeBlanc, who is a disability rights advocate who works at the Development Disabilities Administration. Nicole?
Good afternoon, everyone. My name is Nicola Blank. I live in Silver Spring. I'm originally from Vermont. I'm on the autism spectrum. I'm glad to be here to thank Senator Sanders for including home and community-based services, long-term care, in the new version of the Medicare-for-all bill. Now it can be called a bill that is truly for all. Nothing about me without me. During the healthcare fight in 2017, I stood in amazement at every rally, event, hearing, and protest where people with disabilities like me who were willing to put their bodies on the line, scream and shout and share their stories, all because our healthcare and freedom was at risk. What was most at risk and what scared us all the most was the loss of those home and community-based services. Like many people with disabilities, I need help with things like budgeting, dealing with benefit chaos with Social Security, for example, and finding dental care, something that Maryland, for the last few years, doesn't cover for adults. They just started a pilot for $800, which will take place supposedly in July for people who are dually eligible. But still, $800 is not enough. Most people with disabilities have higher dental care costs. HCBS services help with, dealing with the system. I was so excited when I read the Medicare-for-all in 2019 Sanders bill includes long-term services and supports as a benefit. This bill will support people living in the community where we all belong. When this bill becomes law, the almost 1 million people with disabilities on waiting lists for HCBS services will have access to them because it is for all. when I moved to Maryland, the services that I had in Vermont that allowed me to be successful as a working advocate did not move with me. I had to reapply through Maryland's system, which the system is based on institutionalization, IQ. We need a system that's, based on function. No more IQ, no more being at risk of institutionalization. And a system that can serve the whole spectrum, regardless of severity. I had to reapply through the Maryland system. This means people like me who want to move for work can get the services and have them come with us, just like money follows the person. It moves the money out of the institution, same here almost. And I am so excited that this now would include dental services. Over the past year, I got a dental consultation and discovered I need $5 to $8 grand worth in dental work, and I have gum disease. In Maryland, however, there's an $800 cap soon to be implemented come July. However, most of us need more than that. I am so honored to be here and thank Senator Sanders for introducing a bill that is for all and will help people with disabilities stay healthy, happy, and productive. People with IDD are a medically underserved population and often have worse health outcomes. And studies show that people who get HCBS services are healthier than those who don't. I call on Congress to work in a bipartisan fashion and make long-term care accessible for all people with autism and other disabilities. Community-based long-term services is something that affects everyone, regardless of political party. It is a nonpartisan issue. I call on Congress to get Medicare-for-all passed in a bipartisan fashion now. Long-term care is a human right. And face reality, if we all live long enough, we'll all join the disability club. And you're all welcome.
Thank you very much. And now I'd like to introduce Dr. Perry Tsai, who is a physician and the national president of the American Medical Student Association from Virginia.
Thank you, Senator Sanders. Hello, everyone, again. My name is Perry Tsai. I'm the national president of AMSA, the American Medical Student Association. I recently graduated with my MD, PhD from the University of North Carolina at Chapel Hill School of Medicine. Thank you. I am representing here the voice of AMSA's 27,000 members. This is the voice of 27,000 physicians in training, an independent voice for the future of medicine. And with that voice, we as future physicians are here to say that we want Medicare for all. Yes! As medical students, we all start out with this dream, a dream of becoming doctors, physicians, true healers for our patients and our communities. We signed up for hours of studying, months of clinical rotations, years of residency training, all to achieve this dream. And what do we learn in all of this training? We learn how to do procedures, what drugs to use, what clinical decisions to consider. We learn how to think critically, ask questions, how to diagnose a problem and tackle it. We learn all of these things in order to become a physician who cares for our patients, our families, and our communities. But what else do we learn? For every procedure we perform, we've also seen the exasperation flash across a doctor's eyes as they field another call from the insurance company. For every drug we memorize, we've also watched pharma executives drive up the price of medicines such that our patients can't even get them. For every clinical recommendation we make, we've also sat quietly with a patient who's choosing to leave the hospital or skip their medication because they don't want to strap their family with the bill. For everything that we learn on our way to becoming physicians who care for patients, we find one more thing that's going to prevent us from caring for our patients. For every medical student that's burning bright with passion, there's a future physician who's burning out from the administrative burdens, the loss of connection with their patients, the feeling of powerlessness generated by a system that values profits over people. As our country faces a looming physician shortage, we're finding more and more reasons to just stay away. Our dream is turning into a nightmare, and we will not stand for it. Yes. So we're thinking critically, we're asking questions, why is it like this? Why does it have to be this way? We're diagnosing the problem, we're looking for solutions. The root cause is that in our country, healthcare is controlled by insurance companies, pharmaceutical companies who value profit instead of healthcare. Senator Sanders here is offering a real solution today in Medicare for All. Medicare for All means our patients will all have health insurance regardless of their employment status and have access to the health care they need. Medicare for All means that physicians can spend more time with their patients and less time dealing with insurance companies. Medicare for All means that pharmaceutical companies will have to negotiate to make drugs affordable for everybody. And ultimately, Medicare for All is about justice. So many of our problems that we have in the United States, racial inequality, economic inequality, all of these either start from or they lead to healthcare inequality. Medicare for all is a step towards healthcare justice, is a step towards economic justice, is a step towards racial justice. We at AMSA believe that healthcare is a human right, and we at AMSA envision a more just world where we can fulfill our dreams to become physicians providing that healthcare. That's why we need healthcare for all. That's why we need Medicare for all. Thank you.
Great job. Thank you very much. Keep up the good work. Deborah Berger is a registered nurse, and she is co-president of the National Nurses Union. Deborah?
Good morning, everyone. How are y'all? Good. So I am Deborah Berger, a registered nurse and president of National Nurses United, the largest union and professional association of registered nurses in the United States. Thank you. The introduction of Senator Sanders' Medicare for All Act is a clear sign that guaranteed care, real health care for every resident of this country, not just insurance that tens of millions of people can't afford, is coming. Thank you, Senator Sanders, for your lifelong commitment and leadership on winning Medicare for all and health security for our families and our community. And I want to thank the entire Senate co-sponsors of this vital legislation. This day and this bill have a special meaning to nurses of America. NNU members have worked for decades to achieve fundamental transformation of our healthcare system, one based on patient need, not ability to pay, on caring and healing, not on profiteering of sickness. Nurses see the pain and suffering of our patients every single day. We care for patients abandoned by a cruel system that limits and denies their access to health care. We see patients and families who are forced to make unconscionable decisions that no one should have to make, whether they get treatment and care they need, or pay for their rent or mortgage bill, or food for their children. That's the real America we nurses see. The America where 1/3 of all GoFundMe accounts are for medical bills. Yes. That's outrageous. Last year alone, Americans had to borrow $88 billion to pay for health care. That's not something that should ever happen in our America. We can no longer accept a system that treats people as commodities, enriching private wealth rather than public health. We're going to change that. Other countries with sane, humane healthcare systems, such as proposed in the Medicare for All Act, have demonstrated there is an alternative. The U.S. spends almost 3 times the average of other industrialized countries on healthcare. Yet, we fall far behind on critical areas such as life expectancy, maternal and infant mortality, deaths from preventable diseases or complications, and disparities based on race, gender, and income. It's going to be up to all of us to make Medicare for all a reality. NNU is working with nurses and healthcare activists every day, talking to voters across the country. We have organized tens of thousands of volunteers who are making phone calls, knocking on doors, and going out into their neighborhoods and communities. They and we are working to build a grassroots movement that will pass Medicare for all. No matter how much the insurance companies or the pharmaceuticals stand in our way, we are going to win Medicare for all. Just as it took millions to abolish slavery, to win the vote for women, to ban child labor, and to end racial segregation laws. Make no mistake, we are going to win this too. Thank you all.
And last but not least, I want to introduce somebody who's been fighting for Medicare for all for years, Senator Richard Blumenthal of Connecticut. Dick?
Thank you. Well, I think I am the last and the least. And I say that without any false modesty, because following such eloquence from a nurse and a doctor is even better than following Bernie Sanders. But I was proud to stand with Bernie Sanders when he introduced this measure. I was proud to stand with my Senate colleagues, and I am prouder than ever today to stand with you. This is what America looks like. It's a memo to Donald Trump. This is our future, Medicare for all. I just came from a hearing in the Judiciary Committee for the nominee for second in command in the United States Department of Justice, which is arguing in court right now that the Affordable Care Act should be decimated, destroyed, abandoned. So we are here to represent America and the needs of America. Now, I know, because I have heard it from countless other doctors and insurance companies and pharmaceutical companies, it will never work, it's impractical, it's unrealistic, it's a dream. And they're right. Medicare for all is a dream. It's called the American dream. The American dream is real for many Americans who can afford high-priced health insurance and high-priced pharmaceutical drugs and high-priced doctor care. But even with the great progress we've made, 34 million Americans still are uninsured. The debt, as you just heard, that Americans incur every year is $88 billion. It drives them into bankruptcy. Medical debt is the biggest cause of bankruptcy in this country, which means everybody loses. And the fear of bankruptcy causes people to walk out of pharmacies without the medicine they need to make themselves better and to enable them to come to the workplace and do good stuff for all of us that we need for a thriving economy. You know, I think it was Bruce Springsteen who said, nobody wins unless we all win. That's right. Nobody wins unless we all win on health care. That ought to be our motto in the United States of America. That's the American dream. That's our dream. We are going to make it happen. Medicare for all is our future, and we have to make it our present. I want to thank all of you for being here today and giving us the hope and inspiration to keep fighting, because we're going to keep fighting. Thank you so much.
Okay. I think you heard from everybody, and the message is the same. Together, from coast to coast, we're going to roll up our sleeves. We're going to take on the insurance companies. We're going to take on the drug companies. And we are going to fulfill, as Senator Blumenthal said, the American dream. And the dream is that every American, no matter what your income, no matter where you live, is entitled to health care as a human right, not a privilege. Thank you all very much.